Hello, everybody, and welcome back to another episode of The Root of the Matter. I'm your host, Dr. Rachaele Carver. Today, I'm excited to have Geralyn Beers with us. She is going to talk to us about Recode, which is Dr. Dale Bredesen's Reversing Dementia program. And Geralyn has been very involved in helping get dentists on board with this whole reversal of dementia. So let me tell you a little bit about Geralyn. She has spent 39 years as a dental hygienist in both private practice and public health. She's a founding member, past board member, and fellow of the American Academy for Oral Systemic Health. She's a member of the American Dental Hygiene Association and has attained status as a Bell-Doning preceptor, leading the way in heart attack and stroke prevention through collaborative care. As a pioneer for oral systemic health, Geralyn wrote and appeared in Say Ah, the world's first documentary on oral health produced by Gary Cady. She has spent the last 12 years living her passion of changing people's lives through education and awareness of the mouth-body connection by coaching dental teams and helping them collaborate with the medical community. As the director of dental training for Apollo Health's Recode 2.0 certification, she is excited to help dental professionals expand their knowledge in dementia prevention and reversal and further elevate their dental teams to Recode certification. So Geralyn and I can't remember exactly when we met, if it was through Recode, but I recently finished the Recode certification. I loved it. There was just so much great background in nutrition. It completely parallels very well with oral health. So why don't you tell us a little bit how you got involved from going from a hygienist to doing all this great collaborative work?
Oh, absolutely. Okay, so my history, as Rachaele, as you mentioned, is that I was in the area of consulting with dental practices, and as we all do, those of us that are involved in oral systemic health, we're always wanting to learn more and more and more. And I came upon um, some information regarding the brain. Oral brain connection, and thought that was fascinating, that pathogens were getting into the brain, and they were finding them in patients that had Alzheimer's disease. And so it was about that time that I reconnected with a dear old friend of mine, Dr. Chip Whitney. Many of you know him if you're listening to Rachael's podcast, and he is so involved in oral systemic health as a medical physician. And he was involved with Dale Bredesen already, trying to pull in the dental aspect, pull in dentists into the Recode program. So it was a perfect opportunity for us to collaborate and have me really take hold of that for him, since he is a practicing physician. So I really just jumped in. That's been about 1.5 years, and it's been going great. But we need more dentists on board. Absolutely need more dentists on board.
And so tell us a little bit about what is Recode and tell us how Dr. Bredesen, until now we kind of think as once you have dementia, that's it. It's just a slow decline. There's no reversing it whatsoever, but that is not what Dr. Bredesen has found. So tell us a little bit about Recode and how we can reverse these things.
Sure. First of all, for those that may not know Dr. Bredesen, Dr. Bredesen is a world-renowned neurologist, Dale Bredesen. He spent his entire life, over 30 years, researching the cause of Alzheimer's disease. And what he came up with is that Alzheimer's disease there is not one cause for Alzheimer's disease. So mainstream medicine will have you believe that, as Rachaele, as you're saying, that it's not reversible. Most people will die within 3 to 11 years. It's really sad. And as a little side note, one of the participants in Dale's program who has reversed her dementia says that, the mainstream message is really providing false hopelessness. And I loved that term, because even the Alzheimer's Association is saying there is no cure. So Dr. Bredesen discovered that there are multiple contributors to cognitive decline. There is not one. So research has told us for years about the amyloid beta plaque hypothesis, right? We get amyloid beta in our that deposits in our brains, and it triggers a neurodegenerative process. It creates neuroinflammation and tau tangles and synaptic dysfunction, and then cell death. And that's how you lose your cognition. But really what Dr. Bredesen, discovered is that those deposits of amyloid beta plaque are actually a protective mechanism. They are a part of our innate immune system, and they develop in response to numerous assaults on the brain. So he has uncovered more than 36. He started with 36, but I believe he's up to 42 or 43 contributors to cognitive decline. So these are different types markers of inflammation and chronic infection, dysbiosis. There's hypoxemia, which brings us to dentistry, right? All different types of toxins, and then you have the genetic predisposition. If you have the ApoE4 gene, you are more likely to develop Alzheimer's disease. It doesn't mean that you'll get it, but if you carry one copy of that ApoE4 gene, you are at a 30% higher risk, and that's about 75 million Americans. If you carry two copies of that ApoE4 gene, that places you at a 50% higher risk. And some studies are showing up to 90% higher risk, and that's about 7 million Americans. And in the past, people didn't want to know what their ApoE4 status was because it was really thought that there's nothing you could do about it. But Dr. Bredesen's program, called Recode, and it stands for Reversal of Cognitive Decline, okay, Recode, is showing that you can actually reverse this process of cognitive decline by removing these known contributors. And so this is what he focuses on with a precision medicine protocol for his patients. Last year, it was August 2022, he published his first clinical trial in the Journal of Alzheimer's, showing that he was able to successfully reverse 84% of his patients in the trial. So it was a loud shout out to the world that Recode works. And now it's about getting the message out and trying to, really bring in physicians and dentists and create teams that can help patients reverse their cognitive decline.
And, I think the one interesting thing I found about Dr. Bredesen is he was a researcher, and his initial first 10 or 20 years was all about trying to find a drug, right? That was his main research, was trying to find, and just over that time, he's like, nothing works. And I believe it was his wife, right, who may have mentioned something about the more holistic approach. And so that's when he started looking at lifestyle and these other, factors. And so he was hardcore, researcher, all about the pharmaceuticals. So when somebody comes out of that world and into this, that's exciting to me, because sometimes people are just so focused they can't see beyond their little narrow scope and they refuse to look at other things. But he was so frustrated, right? Because he spent so much time and energy and none of the drugs. And he has great I think in that study they show great bar chart, right? If they show the most common drugs used for Alzheimer's and comparison, and none of them stop dementia. All of them can slightly reduce the, or they slow the progression, I guess, right? But none of the drugs out there stop anything. Whereas when we change our lifestyle, when we recognize these different, so he has grouped the different types of dementia into these subtypes, as Geralyn was saying, whether it's, a toxicity issue, if it's a trophic issue, so if there's a hormone problem. And so based on that, he can individualize the person. So I think that's the other reason why I think a lot of these drugs don't work, because we're just, we're trying to target one thing where that person's dementia may be caused from something completely different than the person next to them, right? I think that's where a lot of drugs fall short, because although we all may exhibit similar symptoms, the actual root of the problem could be vastly different. And, that's why we have so many side effects. That's why so many people, don't necessarily get better sometimes with those types of drugs. And so talking about dentistry, one of the big subtypes is toxicity and infection. And it's one of the hardest ones to treat, because some of these toxins can be so insidious and so they can be locked into our brains, right? They can be locked into our livers, and they're hard to remove. And then these chronic infections, a lot of times people aren't looking for them because the symptoms are kind of vague. I feel tired, or I have this, weird symptom. But, that's what we see in the mouth all the time. These are where all the hidden infections, not all, but so many of hidden infections are present. But because we don't manifest any pain in our oral cavity, nobody looks. Not just the physicians, but even dentists. We're not trained to look for these things. There's a growing number of us who are biological, and we understand how much these oral bacteria contribute to disease, but we need to get the word out. One of the reasons we're doing the podcast, right? We need to create this awareness because there is hope. There is hope for so many chronic disease. We just need to know where to look. We need to find those providers who can, help us sort out these different issues. So what the other big problem we have is the hypoxia, right? Not getting enough oxygen. So I actually just last night gave a webinar to the Airway Circle. We're talking about sleep apnea. Over 50% of adults over the age of 65 have sleep apnea. And then there's another big percentage that may have upper airway resistance syndrome. So it's very significant. 1 out of 2 people can have this sleep apnea. And this is something that another thing that we dentists are just starting to try to screen for or to look for. It's not as simple as saying, do you snore? Right? Most people are like, I don't know, I'm asleep, and even their partner may say, yeah, maybe they snore, but how significant? And although snoring is so common, it's not normal, right? We're not supposed to be snoring. That's some kind of dysfunction happening there. So we really need to investigate that, because if we're not getting enough oxygen, nothing's working really well. So we've got to screen for that sleep apnea. And we've got to look for these dental infections, right? I mean, especially in upper teeth, right? You have an infected root canal or infected tooth, an abscessed tooth. There's a very thin bone between your sinus and the brain. So really easy for that infection to go in there. And I love what Geralyn also pointed out. We talk about the beta amyloid, and that was a really important thing that we noted, that a lot of the drugs were targeted at getting rid of this beta amyloid, when in fact that it was a response of the infection. So we know if you're building up a lot of this beta amyloid, then we know we've got to look for the source of that. What is activating that immune system? So that's when we look toward those infections and to those toxicities, right? So how is the Recode certification working with, we're training dentists, and then what is the dentist doing in the office?
Well, so here's the thing. We have about more than 1,500 practitioners trained in the Bredesen protocol, so that these are physicians. We also have health coaches trained, okay, because a physician can't do this alone. And that is because once you've identified all of the contributing factors, okay, it's now time to remove them, right? So we need to work with the patient to remove all of these toxins and viruses and the inflammatory markers that they're, whatever's causing their inflammation. But then the next phase of that is resilience. We need to get their body back into the proper state where their biochemistry is in a place where it can now start to rebuild. And then Dr. Bredesen uses something called the Bredesen 7, which are lifestyle factors. Okay. And in order to do that, we're talking about nutrition, exercise, sleep, stress, brain stimulation, and detoxification, and supplements. And in order to do that, it's very difficult for a physician to do it on their own. So they need the help of a health coach. So usually we have our physicians working in conjunction with a health coach. Now, the physicians, as they're looking for markers of inflammation, for example, they are going to need to call upon a dentist to find out if there are any periodontal pathogens in there that may be causing a chronic systemic inflammation in this patient's body. And so they're really needing to rely on the dentist, relying on that information. Are they having to, are they able to get a cone beam CAT scan to find out if there are teeth that are infected that could be setting off that inflammation? They're also needing to have a dentist involved, as we said, to treat or to assess for. Of course, you can send them to a sleep doctor, but also to assess for the airway issue. Something important to note is that Dr. Bredesen is always mentioning this, and it's very important, is that when we're looking at patients that have obstructive airway problems, we have to be looking at their nocturnal oxygen saturation. And it's the mean nocturnal oxygen saturation that actually corresponds to the pathogenesis of the Alzheimer's disease. So we need to be looking at that, not just apnea hypopnea index. Okay, so that's very, very important. Looking at the mean nocturnal saturation is very important.
And sometimes that can be done. You can buy an oximeter. Those are kind of cheap, I think, and so you can even monitor that yourself. So ideally, we want to be at 95% oxygen saturation 100% of the time. So if you're monitoring yourself and you're dropping below 95, below 90, that's when we start to see some serious problems. Not only is that a problem because you're not getting oxygen, when you have less oxygen, your body goes into the stress state, right? So when we are in that sympathetic nervous system, we are not resting, we are not repairing, we are not in the proper nervous system to be able to get rid of these toxins, right? So maybe if we're getting rid of these toxins, but we're not sleeping well, we're not doing it as effectively as possible. And that's why I love this whole program, because it's a combination, all these different lifestyles. You have to do it all together. And it's a challenge because it's a lot of different, we are in a modern life, our modern society is just completely against, Mother Nature these days, right? We're not in getting the sunlight anymore, right? We're inside all the time. We're getting bombarded by all this Wi-Fi, this media, this artificial light, the food today. Even if you know what you shouldn't eat, there's just so much toxicity in the food today that's become very poor in nutrients because over farming, and again, all the glyphosate and all these other toxins in our processed foods. So having this whole group approach is so important. You have that team, and the health coach is so vital because they can tell you, hey, you need to do all these things. But the health coach is there with you along the way to do one thing at a time, right? You pick, again, with the different subtypes. The cool thing, maybe you can talk a little bit about, if somebody were going to join this program, talk about all of the kind of diagnostics and screenings that they go through to figure out what is yours. And not everybody has only one subtype, right? We may be having hormonal issues and we have a toxicity issue. So that's the other thing that we can see when we do this screening tool. So tell us a little bit about that.
Yeah, so it's interesting because anybody, I should mention that there's not just a reversal program, there's a prevention program. And this is where we have a huge opportunity in dentistry because all of our patients could be getting involved in this prevention program. It's called Recode. And if they're following this prevention program, not only are you going to see their oral health get better, you're going to see their inflammation come down. You're going to see their diabetes getting better. You're going to see their cardiovascular disease getting better because this program is all encompassing, this prevention program. Wait, what was the question?
That, when we first sign up, right, there's a lot of screening.
Oh, yes. There's a website, apollohealthco.com. Okay. Now we would want to direct our patients to this website. And there's a blue bar on the website that says Assess My Cognition. This is a free 15-minute cognitive quotient assessment developed by Dr. Bredesen, which will very quickly assess whether or not they have a cognitive problem. And you will get a report from that. And of course, there's no cost. It's a one-page report, and it's going to tell you, maybe maybe you're not 100% and you belong in the prevention program. Okay. Or maybe you might have a problem, in which case it's going to prompt you for further evaluation. Now, further evaluation, it's going to want you to sign up for the reversal program. If you are not that far along, it's going to ask you to sign up for the prevention program. These are subscription-based programs. So you're going to pay maybe $39.99 a month to belong to the prevention. You're going to pay $79.99 a month to belong to the reversal. And once you sign up, you'll be given a patient portal. And within that portal, it's going to guide you exactly what to do. You're going to need further cognitive assessments. You're going to be offered the opportunity to get specific blood work. And that blood work will be ordered by Apollo Health through Quest. and you'll just go get your blood work. Quest will get Apollo Health will get the results. And then all of this information will be put together. They use an algorithm to create a report. It's about 60 pages, and it outlines where your highest risks are and what your subtype of cognitive decline is or is heading to. So, for example, if yours is glycotoxic, maybe you're pre-diabetic, it's going to trigger, it's going to tell you. And then you are given extensive guides to help you take every step to get to start implementing all of the Bredesen 7. So starting with the KetoFlex diet, which is very, very important, because this is a diet that is going to be able to help you create metabolic flexibility, which we all need anyway to become healthy. Whether you have cardiovascular disease or diabetes, this is going to pull down your glucose numbers. It's going to get you healthy. It's going to teach you how to do that, teach you how to monitor your glucose. It's going to take you through every step. And then they offer coaching. So if you can't do it on your own, particularly if you are already suffering from cognitive decline, you're going to want to get a coach on board. And it's going to ask you, if you are in the reversal program, to also select a dentist. So if you're a dentist out there who wants to become certified, once you are certified, you then go through a brief onboarding process with Apollo Health, and now you will be able to upload your bio, and all of your information will show up on the patient portal, where patients can find you when they're instructed to look for a dentist. We have an oral health guide for our participants, which outlines what they should and should not be doing pertaining to oral health. And so if they want to address these, find out if they have periopathogens, they're going to want to get some pathogen testing. They're going to want to find you. So this is a great opportunity for collaboration. You'll be able to collaborate with Recode physicians and health coaches in your area and put together a team. We have doctors out there that are creating cognitive oral health clinics. These are cognitive assessments, pertaining to oral health. So what is your oral cognitive risk? They're putting this out there. They're marketing this because nobody's listening. Everybody's talking about Alzheimer's disease. As a hygienist, if we have any hygienists listening, how many times does a patient get in your chair and you ask them how they've been in the past 6 months, and they start rambling about how they're taking care of their mom or their dad who's declining from Alzheimer's disease? This is a wonderful opportunity in dentistry because people are not being heard. They need help. They need more than the Alzheimer's Association telling them that there's nothing that can be done. That's false hopelessness, and it's just spreading wildly, and we need to squash it. Dr. Bredesen was just featured in a new film called Memories for Life. It's going to be out on Netflix very soon this month, and you'll be able to see the whole story of Dr. Bredesen, the work he's done around the world, and the people that he's helping. It's a really powerful movie, and it's done very well because it shines a light on what people, mainstream medicine is telling people, that there is no hope, and then it showcases those people that have been able to be helped, and it's very heartwarming and makes you want to run out of there and share the Recode protocol with everybody that you know, love, and care about.
Absolutely. Can't wait to see it. It should be really good. So let's go back a little bit and talk about that whole KetoFlex diet. So, according to research, about 90% of Americans are metabolically unhealthy. Even those of us who may be thin and may not have any outward symptoms or problems or on any medications. And again, a lot of this has to do with our lifestyle, right? We're go, 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 go. We've detached ourselves from natural circadian rhythms. So, and our food supply. So, some people may be familiar with keto, but what does flex mean?
So the flex stands for two things, actually. It stands for it's a flexible diet. So it's really a whole food plant-based diet, but it's not limited strictly to plants. So it allows for meat as well. It's not all plants. So you have the opportunity to be flexible in that respect. And then, of course, the flexibility also means that we're able to use glucose to metabolize glucose for energy, and also fats. Okay, so a lot of people don't understand how important healthy fats are. And this diet is keto, meaning that you're going to be using a lot of fats to not only the fats from your food, but the fat storage in your body to create ketones to fuel the brain. And that will create, a healthier brain. So we want to always have a diet that is plant-based, lots of vegetables, but also very healthy fats. So we're talking about avocados and high polyphenol olive oil and salmon, high in omega-3 fatty acids. Those are really the staple of this diet. And in this crazy world that we're living in, where most people, don't even know what real food is anymore, it's a pretty sad state of affairs. We have to, as healthcare providers, ask simple questions when your patients are in the chairs. I always come from the hygienist perspective, but really, when you look in someone's mouth and you see gingivitis, you see a lot of inflammation. One of the first things I start thinking about is, what's the diet like? What are you eating? And simple questions like, do you get a lot of plants in your diet? Do you, eat a lot of fruits and vegetables? You would be surprised that only 10% of our population is getting the required number of 9 to 13 servings of fruits and vegetables a day. 10%.
Yeah. I'd be even surprised if it's that high.
Yeah.
It is such a challenge. And
when the other point is, Rachel, that people may say, oh, I eat vegetables every day. But what they're doing is they're eating the same vegetables and the same fruit. I eat a banana every day, or I eat broccoli with every dinner. So that repetition is not good, because you're not getting variety, right? So how do we get a real proper amount of phytonutrients into our diet? We have variety. Eat the rainbow, right? Eat the rainbow.
And just to circle back on the healthy fats again, I think, back in the 70s when the whole Ansel Keys 7-country study came out, and it was thought, oh my gosh, the fats are causing all these problems. That's why we have our heart disease is so high, so we have to stop all fats. Well, that was the biggest lie ever perpetrated in the history of the world about nutrition, because that is where then our diet shifted to have a very carb, grain centric diet. And then, all fat was bad, but all fat is not equal, right? Every cell in our body is coated in cholesterol. So when people say, I can't eat butter, I can't eat eggs because of cholesterol, that is absolutely false, and that defies all science. So if you are being told that, it is not true. The science does not support that. So that's one of the problems too with people who get on statin drugs. Statin people have high cholesterol, then you're given a statin, and statin stops the production of cholesterol. Well, the reason your body is making cholesterol is because there's some type of inflammatory problem going on. Cholesterol acts almost like a Band-Aid, right? The so-called bad cholesterol is produced in higher amounts when there's some kind of inflammatory insult in the body. So if you artificially stop producing cholesterol, what is going to take care of all this inflammation, right? So we first need to figure out just same thing we're doing in Recode, right? What is causing that dementia? Why is the brain inflamed? We've got to remove that toxins. But when we take out an entire food group, and again, cholesterol coats every single cell in your body. And one of the side effects of long-term statin treatment is dementia. Because when we replace cholesterol with these polyunsaturated fatty acids like the canola oils and safflower and sunflower, these are really detrimental. These create more of a plasticky membrane. And so our nutrients aren't able to flow as easily in and out of these cells to provide energy. So really, really important. The omega-3s, and even the saturated fats, right? From butter, from animal protein. That's how our bodies were designed. We were designed to eat those kind of meats. And so there's so much science that supports, so people think I can't ever eat meat. There's too much saturated fat. The body is able to absorb and utilize saturated fat well. And it's a lot of these polyunsaturated, these seed oils that become, not only are they highly processed, but they become oxidized very easily. So if you have canola oil that's in a clear plastic bottle, one, the oil is going to be pulling the plastic from the container, and it's also the light causes oxidation. So when you're eating that oil, it's already oxidized, and again, your body can't utilize that to make healthy cell membrane. So fat is a super huge component, and the brain, fortunately, we can use ketones, which are a breakdown of these fats, to fuel the brain. Glucose is the number one fuel, but ketones can also be used. And the other thing about healthy fats is that actually within the cell, when you metabolize healthy fats, you create what we call structured water. So I used to always think, I was like, I don't understand how my dog can go all day long. She urinates all day long, but she never drinks water. And I was like, how can that be? But she was eating, nice with my dog. I can control exactly what she eats, right? So giving her, the healthy, fresh food, her body was making its own water. So she didn't need to be gulping down, like we say, half of our body weight in ounces a day, right? That's a typical saying that you hear a lot of people say. But when we're eating these healthy fats, we're creating our own water, which is helping us detoxify. So just drinking straight water all day isn't necessarily the type of water that our body needs to help flush this out. And so that's another avenue, another reason why it's important to incorporate these healthy fats.
Rachel, you bring up a good point about water too, because our water is very contaminated. And we're talking about plastics in the water supply that are just, becoming way too common. Yeah. So I think, didn't you mention to me that your children, you always show up with plastics in their
so we have uranium in our, we live in a kind of a rocky area, and every time I've done a hair test, we show high levels of uranium in our water. So I bought a water distiller. It goes on my countertop. Absolutely love it. And I make a couple gallons a day, and that's what we drink and it was interesting. So recently studies have come out that a lot of spring waters have tons of these PFAS. So it's called PFAS, these plastics. And so I bought a couple tests, and we have filtered well water. I mean, our filtration is ridiculous. There's so much filtering and structuring and you name it, we got it going on. And this test tested for something like 75 different plastics. In our filtered well water, we had one PFAS. I went across the street. We recently purchased some property across the street. It was natural spring water coming off the mountain. Nothing in that beautiful, healthy spring. I was like, oh my gosh, this is amazing. We actually have this great clean water. And the company was like, I'm confused because this one said it was unfiltered and this test was filtered, but the unfiltered didn't have any. I said, I know, it's like fresh, amazing, getting filtered from the natural mountain, which is what spring water usually is. But again, so many sources now are so contaminated. We're just lucky in our little haven that we have up here. So
well, not to mention the fluoride in the water as well. Mm-hmm. Okay, so I mean, this is so controversial, but it's we just need to get away from the fluoride. It's a neurotoxin, and that's all there is to it. Fluoride is a neurotoxin, and it is very dangerous to our brains. And so Dr. Bredesen is very serious about people making sure that they're not ingesting fluoride.
Yeah, we're fortunate in our area in the Berkshires of Massachusetts. There's no water, or there's no fluoride in our water, so we're fortunate in that aspect. But the other problem with fluoride is it interacts with iodine. Where iodine, we need iodine for our thyroid, and fluoride, because it's on that same halide group, it will replace the iodine. And so many of us walk around in hypothyroid states, right? And we need thyroid hormone is absolutely vital for metabolism. So when we don't have enough of that healthy energy, so that's another reason we need to be careful. Bromide, again, in that same halide fund. A lot of wheat products are brominated. And again, that interacts and kicks out the iodine and makes it harder to produce healthy thyroid hormone. So that's why we have to be really careful looking at these whole foods diet, looking for the organic, if we can. It's getting harder and harder, I believe, because all these things are in the air and in the water. So, but when you talk to a lot of practitioners in the functional medicine world, and they are all big proponents of distilled water. It's the only way to completely get everything out of the water. reverse osmosis is okay, but it's still not as pure as this. And then some people say, oh, well, you can't drink distilled water. You can, that's not
You can
really
add
true.
minerals, right?
I add minerals to my,
Yeah.
I add a pinch of sea salt and a mineral drops to my water, give that to my kids, because that's another thing. Most of us are really lacking in minerals. Again, the amount of minerals in our food today is half what it was just a generation ago. So, and that's where I see a lot of decay. People want to just keep pushing fluoride, but really what's missing in the teeth are the minerals. That's what we really need. And this all these toxicities create nutrient deficiencies, right? And then we've got all these, and this is what really causes the overgrowth of all these bugs, right? It's not like all of a sudden one day we just swallow these bugs and we get gum disease, or we swallow these bugs and now we have cavities. It's much more complex than that. It's this whole environment. So, and some people may get dementia, some people may get an autoimmune condition like MS, or some people have heart problems. But at the crux of it, it's all of this, exactly how Dale makes his little subtypes, right? Your insulin metabolism, you're insulin resistant, right? Your glucose metabolism is off. You've got infections, you've got toxins, your hormones, because when you don't have the right amount of nutrients, you can't make the proper amount of hormones, right? If you have insulin resistance and then you're trying to be carb restrictive, then you're not making hormones. You need carbohydrates to make hormones. So this is where, one of his subtypes is the trophic, when, especially as women, right? When we start to drop our estrogen and we drop our progesterone, those are really important. I was just listening to a podcast recently talking about how estrogen is really a stress hormone, which, we tend to think of it as the female hormone. But that can drop. But even though that drops, our progesterone may drop even lower. So we still can have estrogen dominant. And some of us may have genetic predispositions like myself. We don't detoxify the estrogen properly. So then it becomes more toxic and creates more stress. So getting those balanced is a really important factor, again, for the brain. I remember in college, I did a study on, we were giving mice injections of estrogen because we were testing their memory. And we would put them through a little maze. And, the more estrogen you have, the better. Really, it's more kind of spatial visual memory. But same thing. I know sometimes when I'm getting stressed, I always fumbling for words. I'm like, what is that word? And that's a common sign of, hormone imbalance. So when we have those kind of things, you got to think, okay, body's a little bit too stressed out. Need to take a vacation or just sit down and read a good book or something like that. But all of these factors, when they get out of balance, they all can contribute to the dementia. So, as dentists and hygienists, anybody else listening out there, when you have these things, know that there is hope. And that I love the program that Dale has created. It is the resources on Recode. I mean, this has taken years and years and years of dedicated people to create these phenomenal resources so that you are not alone. Because that's one thing. You may hear something and you may become aware, but then it's like, but now what do I do? How do I do this? There's so much to learn. And that's why Recode is fantastic, because they have your dentist, they have your physician, you've got your health coach walking you through it. Now they even have, so then I think food is one of the hardest things to try to change. But now they have a food service, and I've tried it, and it's fantastic. So you don't have to worry. You pick the meal that you want, whether you want to be vegetarian or you want to eat meat, all sorts of different combinations that you can choose from, and they deliver it right to your door. So because that's a big stress, having to cook or trying to figure out what to eat. And the last thing we need when we're going through these things is more stress. So I think that's one of the other phenomenal resources that Recode provides for you.
And nutrition is the mainstay of this entire program. You have got to be following the KetoFlex 12-3, which, by the way, is, it's a fasting, as I think we talked about that, right? It's a fasting diet. So you want to be fasting at least 12 hours, and 3 of those hours should be prior to bed. So you can set yourself up for good sleep, because it's all really on a foundation of proper sleep. And if you're not sleeping, it's a vicious cycle, right? We get in that vicious cycle. We should mention that anybody who wants to become Recode-certified, any dental or medical professionals that are listening, can find the information on the website, apollohealthco.com, under the practitioner tab. Get certified, and they can also reach me through that tab. And I wanted to provide a code that could be used for the dental training. The code would be CHH500. To get $500 off the training. This is a valuable training. I haven't had a single dentist go through this training that has not contacted me to tell me how phenomenal it is. So it's really worth your time. And it's 18 hours, by the way, the certification. So if you're thinking, how much time is it going to take me? It's self-paced, it's modularized, it's done beautifully. So you get a portal and log in, and it's really, really easy.
It is. It's very well organized. And, I think I did it over maybe a 4-week period, on my weekends here and there doing that. And it's nice how it's divided into different modules. So you can do, one at a time. Some of them are a little bit longer than others, but there's just so much amazing information. And I made a whole book, and I will refer back to it all the time because, again, it's relevant to so many chronic issues, including, dental disease. So, really, really valuable. Anything we can do as dentists, the nice thing I think about being a dentist is we kind of have this dedicate this audience, right? They can't speak. So for 45 straight minutes, for your average appointment, we can help create this awareness. We can educate our patients about diet, about exercise, right? That's another really key pillar, again, is to get that oxygenation, right? As dentists, we need to talk about that airway, talking about that exercise, talking about diet, nutrition, and looking for those infections that are leading to inflammation. Because the other thing I think that's great about being a dentist is that the mouth is so accessible, right? It's a lot easier to treat a dental infection than it is, gut dysbiosis or, something down there. So we can make a huge impact on chronic disease in general just by evaluating and removing these infections that are contributing, right? I mean, 20% of our lymph is in our head and neck. And when we sleep, another reason why sleep is like the foundation of this whole protocol, our lymphatic system, the lymph that's in our brain shrinks when we sleep. And in that shrinking of the brain, we squeeze all of that lymph, and that is how we're supposed to drain the brain. So if we're not sleeping properly, we're not getting that flushing out of the brain every night. So that's super, super important. So if we have chronic sinus infections or, tooth infections or gingivitis, whatever it may be, and our lymph is clogged, we keep recirculating those toxins, which can lead to that increase in those, beta amyloid plaques, which then, can create some of that dementia. So it's a really, I think, exciting time to be a dentist. I think we or one of the practitioners can make some of the greatest impact on our patients. And so I highly recommend all of you to look into Recode, Precode. I think I'm going to be starting part of that group of dentists in collaboration cures. We're all kind of doing it as a group study, which I'm really excited about. And you've given us a great code. So tell us that code one more time.
Yes, the code is CHH500.
Okay, great. And again, the website
is Apollo Health. So APOLLO Health, HEALTHCO.com.
Great.
Think of Apollo Health Company.
There you go. So I definitely recommend everyone to go take a look at the website, get certified, and let's help change the world. Let's reverse this.
Oh, and
dementia.
They should also check out Dr. Bredesen on Instagram because every day he posts new science. Every time you learn something, it's really fascinating. Instagram, right. Dr. Gail Bredesen.
And his new movie again is called what? That's coming out soon?
Memories for Life.
All right, everyone check that out. Well, Geralyn, thank you so much for being with us today. I hope everybody learned a little something. And the most important thing is that there is hope. Dementia is not a death sentence. And there's so much that we can do to not only prevent the decline, but actually reverse it. So I hope everyone has a great day, and we'll see you next time on The Root of the Matter.